Welcome to Understanding Advanced Old Age, our last developmental section of the Growth and Development series. So, this video is going to be a little bit different in terms of there are quite a few concepts that are covered in this video that were covered in the last one. So, if you have not watched the older adult video yet, I would recommend doing that first and then coming back to this one. Um, so because there is some repetition, I'm going to be bringing up some additional points in terms of advanced old age and our role with that as the nurse. So the audio and the PowerPoint slides might not match up, 100%, but just wanted to give you that disclaimer now. Okay, let's get into it. Now, in advanced old age, functional changes become more common. This may include decreased mobility, increased fatigue, sensory loss, and greater dependence on assistance for daily activities. However, abilities do vary widely, so age alone does not determine function. Okay. Now, we often see too that this stage is often referred to as the quote oldest old and comes with increased health challenges. But we will see that, development and dignity continue nonetheless. Okay, so a HESI tip for you is to remember to assess the individual, not the number. Now, something that we need to think about is activities of daily living. So our ADLs become a central focus in advanced old age. These include bathing, dressing, eating, toileting, and communication. Okay, so supporting ADLs helps maintain dignity and that quality of life we were talking about. Now, cognitive changes, like we have mentioned previously, may increase with advanced age, but nurses must continue to distinguish normal aging from pathology. So, routine, structure, calm communication, and memory aids can greatly support cognitive function. Now, immortality versus extinction. Here, you know, we're really looking at that grappling with, the patient's life's impact, seeking to leave something of value, whatever that may be for, that specific patient. Now, older adults in advanced age are at a higher risk for malnutrition and dehydration. We see changes in appetite, in dentition, swallowing, and mobility, which all contribute to this. So we have to monitor intake closely and advocate for appropriate support. Okay, as mentioned in the previous video, right? Intimacy doesn't have an expiration date. Um, and one of the main key points of this is to approach this topic with sensitivity, and realize that intimacy takes many forms. Okay, and as you can see, I'm flipping through some of these slides here. As I mentioned, I would reference the previous video if you have not watched it already. Okay, here we do see some various living options for geriatric adults. Um, and it really is going to depend on the patient. Some patients, remain in their home until the end of life. Sometimes we see multi-generational living, assisted living, and some patients do need, skilled nursing facilities to support them until the end of life. Now, advanced old age often includes discussions about end of life preferences, advanced directives, and goals of care. As so many other things, these conversations should be handled with compassion, respect, and patient autonomy. So, a HESI safety note: honor patient wishes whenever we possibly can. Okay, now the nurse's role in advanced old age centers on comfort, on safety, dignity, and advocacy. Even when independence is limited, respect and person centered care remain essential. So, your final takeaways for advanced old age. I want you to remember this: development continues until the end of life. Individual ability matters more than age. Comfort, dignity, and respect are priorities. And excellent nursing care honors the whole person at every stage. All right, we did it. Now, there is one more video after this one. So, in the next section, though, we're going to be doing a bit of a summary and then looking at some clinical application. Um, so that way it'll help you prepare, bring the material in to apply it for your exam. All right, you know the drill. I'll see you in the next one.